Assalamu alaikum. Welcome to the RG Dental. Again, we are with a new topic so called medical history that is very important for the diagnosis and the treatment of the medical diseases. Each and every doctor must know the proper method of obtaining the data from the patient. Simply, it is the proper listening to the patient complaint. History, it is the communication method of getting the observational data from the patient for his illness, and studies suggest that 80% of your diagnosis depends upon the history you take from the patient, and 20% depends upon the investigation you do for the patient's illness. The history starts with the introduction of the doctor to the patient. You introduce yourself that I am a doctor and I am working as a resident or I am a medical officer. So you introduce yourself with your name and your designation. Then you ask the patient that what's your name and what thing that has lead you to come to the hospital. So the first step of the medical history is the introduction of the doctor to the patient. Then patient's introduction is in the form of biodata. In the biodata, we have to first ask the patient's MR number that is already written on the slips that patient came with in the registered hospitals. So the MR number will represent the patient's record and the patient's list in the number. In the MR number, we have to check the patient's previous treatments that he had undergone. Then after the MR number, you have to ask the patient what's your name and surname. That will create the confidence in the patient when they are asked with their name. And after the name and the surname, there is the gender. That is a good intellectual point because some diseases are common in male patients such as hypertension, ischemic heart diseases, cerebrovascular accidents, and the lung cancer. And some diseases are common in female patients such as depression, autoimmune diseases such as SLE, and the breast cancer and the primary biliary cirrhosis. After the gender, you have to ask the patient's age because some diseases are common in childhood and some are common in the adulthood and the old age, such as chickenpox, measles, and the poliomyelitis that are common in the childhood, and the osteoporosis, hypertension, arthritis, asthma, and the COPD are common in the old age patient. After the age, you have to ask the patient's occupation. What patient do? That is very important because the stress can be a diagnosis of the patient who work in the office day and night and the student who work hard for their achievements. Occupation also give us the indication of the asbestosis that is related to the patient or worker who work in the industrial area, and the patient working in the mining also comes with the different diseases of the lung and the COPD and the asthma. So the occupation is very important regarding the history and the diagnosis of the patient diseases. After the occupation, you have to ask the patient's marital status, that is he married or not, because some diseases that are common in the genetic that can be diagnosed from the patient's marital status, and the contagious diseases that comes with the contact with the other person that can be his wife or husband. So that is very important to ask the patient's marital status. After the marital status, the patient's address, that is very good indicator of the endemic diseases such as human papillomavirus, hepatitis, and the COVID-19 and the HIV. Whenever the area is diagnosed with the human papillomavirus, the female patient from that area are of greater incidence with the cervical cancers. Another point that is very important for the patient from the hill area, that is the fluorosis that can be common in the patient from that area, and the iodine deficiency goiter, that is very much important considerants in the patient from the hill area. Then another point, that is the mode of the admission of the patient, how patient came to the hospital is very important. either in the OPD or the emergency, because the patient who came with the emergency need immediate care with supportive therapy, oxygenation and the nebulization, and the patient who came in the OPD that can be treated with the gradual method. And the mode of the admission also gives us the data of the patient's extent of disease and the treatment need for the patient. Then you have to note down the patient's date of admission or date of OPD, because it can give us the time duration of the patient treatment that he has taken. And the date is also important for the doctor, because it can be a prediction of the doctor that how much the disease has responded to the particular treatment and the particular duration. After the biodata in the medical history, there is the presenting complaint. What has led the patient to come to the hospital? You should not ask the patient any leading question, and you have to note it down what patient says in his words. Don't use any medical terms or any anatomical site. You should write it as simple so everyone can read, and write it exact what patient says, and never ask the leading question from the patient. After the presenting complaint, there is the history of the presenting complaint. In the history of the presenting complaint, you have to ask the different criteria of the question for the pain and the different criteria of the question for the swelling. For the pain, you have to ask the patient different questions that are the site of the pain, onset of the pain, duration of the pain, characteristics of the pain, relieving factor, and the accelerating factors or exacerbating factors, and the timing of the pain, and the severity of the pain, and the associated symptoms, or any radiating or referred pain or not. For the site, you have to ask the patient that what is the exact location of the pain, and use the criteria of the chronological order for the different site of the pain and the duration of the different sites. Then you have to ask the patient the onset of the pain, when does it starts, and the duration of the pain, how long you having this pain, and the characteristic of the pain, either it is dull or aching pain, or sharp or throbbing pain. Then you have to ask for the relieving factor, that what causes decrease in your pain, that can be a painkiller, or sitting at standing position, or eating in the duodenal ulcer decreases pain, and the questions related to the relieving factors. Then you have to ask the patient that any exacerbating factor that increases your pain. It can be due to exercise, or stomach ulcer that increases with eating. So the exacerbating factor and the relieving factor are very important for the history of the pain. Then you have to ask the patient the severity of the pain, either it is mild, moderate or severe. For the severity, you have to ask the patient that this pain is bearable or not. So these are the questions for the history of the presenting complaint for the pain. Then for the soiling, you have to use a criteria of the questions that include the list of the questions, such as how you notice the swelling. That is very important, because some patients notice the swelling due to pain, and the some patients notice swelling when someone says that you have this swelling. That is very important. Then you have to ask the patient that what is the duration of the swelling, how long you have this swelling. The painless swelling with longer duration can be a benign swelling, and the shorter duration swelling with pain can be infectious swelling or can be a malignant swelling. Then you have to ask the patient that what was the size of the swelling when you noticed. Either it was a grape sized or a lemon size, and you have to compare it with the current size of the swelling, because it will give us the rate of the progression of the swelling. Because progressive swelling with the longer duration can be a malignant swelling, and the swelling that are not progressive for the longer duration can be a benign swelling or a chronic infection. So that is very important question to ask from the patient. Then you have to ask the patient that do you feel any texture changes in the swelling or not, either it was soft and now it is hard or not, or it is a fixed swelling or fluid swelling. Then you have to ask the patient that does it appear or disappear with any activity or exercise or any movement. because the swelling of the head and neck sometimes disappear with the movement of head and neck or swallowing or breathing. So it is very important question. Then you have to ask the patient that do you feel any pain in the swelling or not. Sometimes patient notice the swelling due to pain, that is very important, and can be infection swelling. So asking these questions is very helpful for the diagnosis of the swelling. Then you have to ask the patient that do you have any swelling in the body, like the same swelling or not, and the different swellings that occur due to the neurofibromatosis and the different diseases that causes the different types of swelling and multiple swellings. The last question that is important in the history of the presenting complaint of a swelling, that is the what patient consider for the swelling. You have to ask that patient that what you feel for the swelling, either it is due to trauma or any cancerous swelling or an infectious swelling. That is very good for the opinion of the patient, because it is very important to know the patient's anxiety level, and it will help in the treatment of the patient's disease. Now one thing very important for a doctor, that is the progression of the swelling with its fixation and the involving the adjacent structure is very important, because the differentiation between the infectious swelling and the malignant swelling can be diagnosed from the history of the patient. After the history of the presenting complaint of the pain and the swelling, we have to go for the systemic review. In the systemic review, we have the different systems and we have to ask the different questions from the different systems. In the systemic review, firstly you have to ask general questions, that are the loss of appetite or not, weight loss or weight gain history or not, sleeplessness or oversleep or not, any lack of energy or not. Then you have to go for the cardiovascular system, in which you have to ask the patient that do you feel any breathlessness or not, any palpitation history or not, chest pain or not, an edema or not, any blue hand and feet or not. Then you have to review for the respiratory system. You have to ask the patient that do you feel any dyspnea or not, any breathlessness or not, or any cough or sputum, any wheezing or chest pain history or not. Then you have to ask the patient for the alimentary canal system review, in which you have to ask the patient that do you feel any nausea or any vomiting or abdominal pain history or not, heartburn or dysphagia or any diarrhea history or not, constipation or hematoemesis or not, or any bloody stool or not. And in the abdomen you have to ask the patient that do you have any history of jaundice or hepatitis or any stone history or not. Then you have to go for the urinary system. In the urinary system you have to ask the patient that what is the color of your urine, or any fizzy urine, or pain on micturition, polyuria or oliguria history or not, nocturia or not, or any vomiting, any nausea history or not, hematuria history or not. These are the questions from the urinary system. Then in the nervous system you have to ask the patient that do you have any weakness history or not, numbness, any tingling in your hand and feet or not, any headache history, vomiting history, or any blackouts, fits, or fainting, or hearing loss, or diplopia or not. These are the questions for the nervous system. We have to go for the systems and systems. Then you have to go for the locomotor system, the musculoskeletal system. You have to ask the patient that do you have any joint pain or not, or any morning stiffness in the muscles or not, any swelling in the joints or not, any restriction of the movements or not. Then you have to ask the patient that do you have any history of bony deviation or ulnar deviation or not. Then you have to ask the patient the endocrine history of polyuria, polyphagia, polydyspepsia, heat or cold intolerance or not, weight loss or weight gain history or not, sweating or palpitation history or not, or patients aggressiveness or calm patient or sleeping history due to the thyroid diseases, we have to exclude all systems. And then you have to ask the patient that do you have any skin rashes or itching on skin or any skin allergy or not. These are the systemic review from the patient. If the patient is child or any mental retarded patient or unconscious patient, then you have to ask this history from another person. These are the questions for the systemic reviews. So after the systemic history, we have to go for the past history. In the past history, we have to ask the patient that have you been hospitalized for the longer duration or any disease that remain 2 to 3 months or not. If female married patient, then you have to ask for the last time delivery or labor time. If older patient, you have to ask for the last BP check, hypertension history, and the last time MI history. In all patients, you have to ask for the vaccination of the patient for the BCG, MMR, hepatitis B virus, and the COVID-19. And you have to ask the patient that have you received blood from anyone or not, any blood transfusion history or not, any drug history or not, any allergy history or not, because these are the very important question in the past history of the patient. And other question in the past history that is very important, you have to ask for the bleeding time. Ask the patient that if trauma occurs, how long the bleeding occurs. That is very important to note because it is indicator of blood diseases, and this question is so much considerable. Then if a patient is female, then you have to ask for the menstrual history, age of or onset of menstruation, and the date of or duration of each period, length of cycle, and the regularity of the cycle or any pain associated with periods, duration, any site or relationship to the onset of period, or any intermenstrual or postcoital bleeding, or menopause age, or postmenopausal bleeding or discharge or not. These are the questions for the female patients. Then we have to ask the patient that what is the treatment history of the patient for the current disease, that what investigation patient had undergone or any consultation with other doctor or not, or any drugs that patient had taken for the current disease or not, or any history of same diseases in past or not, or any side effect of any disease or allergy to any drug or not. In the family history, we have to inquire about the health of the parents, siblings, children, and the life partner of the patient, and the individual member of the family. In the family history, we have to go for the genetic diseases or any contagious diseases or chronic illnesses in the patient's family, like hypertension, diabetes, mellitus, ischemic heart diseases, asthma, hepatitis, or any arthritis, or any disease that is currently running in his family or not. Then we have to go for the personal history of the patient. In the personal history, we have to ask patient's habits, exercise history, gaming or any stress or depression history, and alcohol or smoking history, and betel nuts history, and any self medication or sleeping pills. Sometimes patients hide these things from the doctor and from the society to have secret for their medical problem. In the personal history and the social history, we have to go for the socio-economic status of the patient and the social behavior of the patient and the expenditure of the treatment the patient can afford or not. These are the simple questions that can be asked from the personal and the social history. After the all history taken from the patient, you have to go for the differential diagnosis. You have to differentiate between the different signs and symptoms of the diseases that have same signs and symptoms, and these can be clarified with the further investigation. That's all. Thank you for proper listening, and if you are new to RG Dental, then please subscribe and press the bell icon and stay connected with us.